My name is Mwamba Mumba. I'm an obstetrician gynecologist based at Ndola Teaching Hospital, which is in the heart of Ndola, the Copperbelt province of Zambia, which is basically almost the northern region of Zambia. I was offered the fertility training program by the Merck Foundation, which I did in India, Rajasthan province in 2021, and I completed that course. Okay. The course offered to me was an intense course. We packed a program almost worth 2 years in 3 months. The faculty was excellent, very knowledgeable, hands-on, willing to help us with every little question that we had, even that what seemed foolish. But because it was practical and we could see it day to day, we ended up grasping so much as opposed to just reading about it in the textbook. We would learn every day of the week, as is in India, and would only have time off on public holidays or at an agreed day with some of our faculty teachers. We had online classes, we had in-person classes, we had hands-on training, we were also availed textbooks, we also went out and practically handled patients where and when we could, even in theater. Okay, so since I came back, I've had colleagues refer to me their patients who are fertility concerned. I continued in my clinics, but even my registrars would know to refer to me their clients who were fertility seeking. So I've had patients come to me. I have one couple who are currently expecting, who I did preliminary tests on. Unfortunately, some others have lost. I have referred some for further medical assistance that we cannot offer in our public institution. We are yet to come up with a specified fertility clinic, a group of us, about 3 or 4 of us who've done this course. So we were trying to work out the logistics of how that would work in our public setting, considering sometimes the limitations, to see what we can do. Of course, I am more knowledgeable about fertility. I am far from the novice that traveled to go and study this course. I'm calmer to deal with the patient. I don't feel overwhelmed. Patients now can come to us and we can give them a baseline of where they are. We could, of course, before, but now the baseline is much more, is richer and much more informed, and we're able to tell the patient to say, in this case, these are your options. We can try this, we can try that. I think in that case, I was a bit more limited in my understanding of the fertility spectrum before the course. I've had at least one successful case. Currently, we keep praying, everything goes as is. One referral who started the workup with and ended up having to refer to a private facility because they needed further care, and the couple has successfully gone on to conceive. We're hoping for the best. Still some are underway who are trying to see referral, because there are options of whether to stay in country or to go outside the country and get further help. I think the other achievement is we've been in discussions with my previous facility, so they tried to make programs that are suitable for the African patient, so that even the price range is also included. At least that's something we started discussing when we were there, so that's a success, because we were able to say, can you give us a package that is tailor-made for our people? And so I'm able to offer that. If the patient needs referral and there's nothing else that can be done here, I can offer them that option to say, you can go and have your medical care taken off at this price range, which is favorable compared to what is obtaining in other parts of the market. I am very likely to refer the cost, about 95% going to refer the cost to my colleagues, because the more we are, the more powerful a service we can offer to our people. You cannot be in a vacuum and think, oh, we're the only ones, and you're overwhelmed, and not in the end your service is haphazard. But the more we are, we offer an excellent service, and iron sharpens iron. We're able to consult each other. We're able to give the service to our people at a subsidized rate. Merck Foundation, you make it possible for the ordinary woman to get what she needs in her setting without feeling overwhelmed or feeling like there is no hope for her. Also, you give us, the medical personnel, a chance to really pursue what we want without compromising either our integrity or compromising our studies or compromising our passion. You make that possible, and we're grateful for that. And I think you embody the Indian motto of local solutions for local problems, because I am a solution for Zambia, and so is the next doctor who gets trained by you. Keep doing what you do. Thank you.